Epilepsy. Epilepsy means seizure disorder. So people with epilepsy have recurring and unpredictable seizures. A seizure is a period when the cells in the brain or neurons are synchronously active or active at the same time. The cells in the brain or neurons are synchronously active or active at the same time when they are not supposed to be like that. Now, when I say neurons are active, that means they are firing or sending a message using electrical signals relayed from neuron to neuron. And if you take a close look at the neuron under the microscope, each electrical signal that passes through the neuron is really just ions flowing in and out through the protein channels. The way this ions flow is controlled by the neurotransmitters. What are neurotransmitters? A type of signaling molecules and receptors. What is the electrical signal that passes through the neuron? It's just basically the transfer or flowing of ions in and out through the protein channels. This is controlled by the neurotransmitters. Neurotransmitters bind to the receptors and basically tells the cell to open up the ion channels and relay the electric message. These are the excitatory neurotransmitters. Whereas the neurotransmitters, which when bind to the receptors, tells the cell to close the ion channels and stop the electrical message, are called inhibitory neurotransmitters. Let's see the etiology of epilepsy. Epilepsy is equally seen in both males and females. However, it is more common in young children under 2 years of age and older adults. Infectious diseases such as AIDS, meningitis can cause epilepsy. The leading cause of epilepsy in people older than 35 years of age is stroke, serious illness or very high fever, lack of oxygen to the brain. Some developmental disorders like autism and neurofibromatosis can also be a major cause of epilepsy. So what exactly happens during seizures? During the seizures, clusters of neurons in the brain become temporarily impaired. Clusters of neurons in the brain become temporarily impaired and start sending out sudden excitatory signals over and over again. And these are sometimes said to be paroxysmal. These paroxysmal electrical discharge is thought to happen either due to too much excitation or too little inhibition, which are kind of two sides of the same coin, right? They are both the same. Too much excitation or too little inhibition. Both mean the same. The main excitatory neurotransmitter in the brain is glutamate, and the NMDA is the primary receptor that responds to glutamate by opening ion channels that let calcium in. This positive ion tells the cells to send signals. Some patients with epilepsy seems to have faster and long-lasting activation of these receptors. On the flip side, the main inhibitory neurotransmitter in the brain is GABA, which binds to the GABA receptors that tells the cell to inhibit the signal by opening the channels. The GABA receptors tells the cell to inhibit the signal by opening the channels that let in chloride ions. Chloride are negatively charged ions, which are negatively charged ions that tell the cell to inhibit the signals. So what do we understand from this? Glutamate is an excitatory neurotransmitter which acts on the NMDA receptor, and thus the positive ion tells the cells to send signals. Okay, on the other side, GABA is an inhibitory neurotransmitter, binds to the GABA receptors and thus sends the negative, and this negative ion tells the cells to inhibit the signals. Also, some patients with epilepsy seem to have genetic mutations in which the GABA receptors are dysfunctional, so they are not available to inhibit the signals. In addition to potentially having a primary genetic cause, these receptors and ion channels might be affected by all sorts of things like brain tumors, brain injury or infections. So, whether it's a decrease in inhibition or an increase in activation, when a group of neurons start firing simultaneously over and over, it's often noticed by others as an obvious outward signs like jerking, moving and losing consciousness, but can also be subjective experiences that are noticed by the person experiencing it, like fears or strange smells. All of this depends on which neurons in the brains are affected. Now, people with epilepsy experience recurring episodes of some form of seizures, and we can start grouping the seizures by the region of the brain that's affected. when the affected area is limited to one hemisphere or one half of the brain, or sometimes even a smaller area like a single lobe. We call it a partial or a focal seizure. Whenever one hemisphere or part of a brain or even a single lobe is involved, we call it a partial or a focal seizure. These can be subcategorized based on the consciousness of the person into simple partial seizure. In this, the patient is conscious, and complex partial seizures where the patient has impaired consciousness. Now let's talk about simple partial seizures. Simple partial seizures typically affects a small area of brain and can involve the person experiencing strange sensations like hearing or tasting something. It also involves jerking movements in specific muscle groups if the neurons controlling these muscles are affected. If the jerking activity starts at a specific muscle group and spreads to the surrounding muscle group as more neurons are affected, it is referred to as Jacksonian march. What is Jacksonian march? Suppose a muscle is twitching, a group of muscle is twitching. Okay, now the surrounding muscle group is also involved because of the nerve supply to that muscles. Okay, now the surrounding muscles also start twitching. This is known as Jacksonian march. The person is typically conscious and usually knows something is happening with him and will remember the seizure afterwards. So basically, in simple partial seizure, the person knows what is happening with him and will remember what has happened during the time of the seizure. Now let's come to complex partial seizure. Complex partial seizure, on the other hand, involves losing consciousness completely. Here the consciousness of the patient is lost or impaired. Patients may not remember what happened during the seizure. Patients will not remember what happened during the seizure. Now, in contrast to the partial or focal seizure, generalized seizure is the one in which both the hemispheres are involved. In generalized seizures, both the hemispheres are involved. Sometimes it starts out as a partial seizure and quickly develops into a generalized seizure. It starts as a partial seizure and quickly develops into a generalized seizure. In these situations, it is called as secondary generalized seizures. That means it starts as a partial seizure and secondarily it develops into a generalized seizure. That's why it is called secondarily generalized seizure. Just like partial seizures, there are subcategories of generalized seizures as well. One subtype is a tonic seizure. Tonic seizure where the muscles all of a sudden become stiff and flexed, which can cause the patient to fall backwards. This is important. This causes the patient to fall backwards because the muscles are stiff and flexed. On the flip side of it, there could be atonic seizures. Atonic seizures where the muscles are all relaxed and become floppy, which again can cause the patient to fall. But now the patient falls forward rather than backward because the muscles are relaxed. That's how we can differentiate tonic and atonic seizures. Seizures can also be clonic, where there is violent muscle contractions, also known as convulsions. Seizures can be clonic when there is violent muscle contractions, known as convulsions. Now there is something called as tonic-clonic seizures. These are the most common generalized seizures where patients experiences a tonic phase where the muscles suddenly tense out. That is, the muscles suddenly get stiff, followed by a clonic phase where the muscles rapidly contract and relax. Myoclonic seizures are yet another type and are short muscle twitches, but sometimes many in short amount of time. Finally, there are absence seizures, where the patients lose consciousness and then generally quickly regain the consciousness. The outward sign being presented by the person is that the person looks like they have spaced out. Like if they were walking, they'll suddenly stand still. Okay, that is absence seizures. The key for all of these type is that it involves both the hemispheres and the patient loses consciousness either briefly or for a longer period of time. If the seizures do last for a longer period of time, like over for 5 minutes of ongoing seizures or having multiple seizures without returning to normal in between the seizures, then it is called as status epilepticus. Let me repeat that for you. If the seizures do last for a longer period of time, like over 5 minutes of ongoing seizures or having multiple seizures without returning to normal in between the seizures, then it is called as status epilepticus. These are usually tonic-clonic type of seizures. but it can also be caused by other types that do not involve convulsions. This situation is considered as a medical emergency and may be life-threatening if not treated immediately. Due to the severity of these seizures, patients are often treated with benzodiazepines, which helps to enhance the effect of inhibitory neurotransmitters, GABA, thus increasing the inhibition. The benzodiazepines helps to enhance the effect of inhibitory neurotransmitter. We want the inhibition to occur. Okay, and thus benzodiazepines help to increase the inhibition. Sometimes patient experiences some symptoms following seizures like post-ictal confusion. What is post-ictal confusion? That means after seizure confusion. Also, patients might experience paralysis in arms or legs, usually limited to one side of the body, and this is known as Todd's paralysis and can last for quite a while and usually subsides by itself after 2 days. It is thought to be caused because of temporary and severe suppression of seizure affected area in the brain. Now let's see how can we diagnose it. Typically after the seizure is over, patients will have brain imaging techniques like MRI or CT scan as well as EEG, that is electroencephalogram, which detects electrical activity in the brain. With patients who have just started having seizures, brain scans are used to find out if there are any anatomical abnormalities like brain tumors or abnormal blood vessels that could be causing the seizures. This can be treated surgically. As we know, epilepsy varies from patient to patient in the type, severity and frequency of the seizures. Diagnosis involves variety of examinations and tests in combination with a thorough evaluation of their clinical history. Now let's come to the treatment part. Once epilepsy is diagnosed, it's often treated with daily medication. The primary form of medication being anticonvulsants, of which there are wide varieties of options available that have different targets areas in the brain. So the choice is based on the specific needs of the patients, including factors like age, lifestyle, other health problems. Anti-epileptics can be given such as lamotrigine, topiramate, ethosuximide. These can be given based on the type of the seizure involved. Other treatment options include epilepsy surgery, where we remove the cause of the seizures like a specific part of the brain or a tumor. Nerve stimulation may also be considered, where certain nerves like the vagus nerve are stimulated, which is thought to control the seizures by influencing the neurotransmitter release. Dietary recommendation is best for children suffering from epilepsy. The ketogenic diet is mostly implemented. Thank you.